afternoon. I'm Holly Dunn with Communities That Care and in Stigma campaign, and today I'm here with my friend Donnie, and he's going to tell you a little bit about himself.
Yeah, well, Holly, I'm Donnie Varnell. I'm from the Dare County Sheriff's Office in North Carolina. It's on the Outer Banks. Prior to that, I was a State Bureau of Investigation, special agent in charge, and where I ran our statewide drug diversion and opioid unit, which is kind of how I got involved into the drug abuse issue for the United States and for North Carolina. And while I was working in that program, we were trying to reduce the overdose death rates in North Carolina, at which time I went through traditional law enforcement techniques, used a lot of legislation and regulations trying to get the numbers down, and eventually I found my way into the North Carolina Harm Reduction Coalition programs, where we were using non-traditional law enforcement methods to try to help the communities that were in need. And we found great success with that, and that's kind of how I ended up in your great state of Indiana to do some site visits.
Well, I'm super thankful for your time today.
No problem.
And I really just have a few questions for you.
Okay.
The first one is, why is harm reduction important to reduce overdose in our community?
Well, I think if people aren't familiar with harm reduction and the harm reduction technique, is it's not abstinence based. It's reaching people that are in need where they're at and where they need help at. Everybody that needs help and needs services needs a particular service, and harm reduction finds what that is, and they help the people with those problems. And they also don't hold any stigma to individuals that are in need. And so if someone has a bad day while they're trying to find better ways in recovery, that's not held against them. They're continued to be helped, where a lot of programs don't do that. Like if you mess up, sometimes you can get kicked out of a program. So harm reduction is unique at that, and it's something law enforcement in the past had nothing to do with. That really wasn't our job. We weren't healthcare professionals. We're not mental health professionals. But with harm reduction, they reach out with these programs. Very basically in North Carolina, we started with naloxone. We made it as readily available as possible. We have one of the best naloxone distribution laws in America, and naloxone saves lives. That's all it does. And we make it as easy as possible for people to get it, and that came through the North Carolina harm reduction, and it does that in other states and in your state, the Indiana harm reduction people. And so it's one of the main things that harm reduction does is that it finds services for people that they need, and it gets naloxone to the people that need it. And also there's numerous programs they run into, and they partner with many organizations and collaborations that are able to reach out to further and further communities, and we're just helping more people. And in turn, it has brought law enforcement into that world.
Which is a perfect segue to the law enforcement question on here, which is essentially how can law enforcement partner with the community to reduce overdoses?
Well, I think what a lot of people don't know about law enforcement is we have certain things that they give us to do. Law enforcement has training, and they have direction from above and below, and from legislators, and then they have the tools they're given to work with. And law enforcement does a really good job at that. I mean, you tell us what to do, you tell us what we can use to do it and how to do it, and we do that. And unfortunately, to a lot of times, that ends up with people being incarcerated that could maybe be better helped from services. And that was an alien concept to law enforcement. Just to me, 5-6 years ago, that was alien. But I was working so hard in trying to find a way to get overdose death rates down. I reached out and I listened to the harm reduction world, and I was able to look at the programs and look at the studies to show the programs work. So in essence, in North Carolina, we were very fortunate. It just all came together, a lot of compassionate people in legislation, law enforcement, healthcare, harm reduction, advocacy groups, peer groups, and we were able to come together and come up with these programs. Law enforcement's biggest thing is just to cooperate. We don't have to do anything. As a matter of fact, the programs that we have discussed, like law enforcement assisted diversion, which is a pre-arrest diversion program, syringe services programs, those are programs we just have to allow to happen. And it allows us to use our law enforcement resources for other uses, like for what people will call real crime, violent crime, instead of running around and arresting everyone for minor drug charges or possession of a syringe. We can be available to be on the street to do more serious law enforcement work. And then also, we carry naloxone in North Carolina. Almost every agency carries it, and we have had about 15,000 reversals altogether in North Carolina, with about 1,000 being from law enforcement itself. So law enforcement wants to help people. It says protect and serve on almost every car and every badge in America. And if saving a life isn't the epitome of that. And so law enforcement has become really a champion in the overdose death prevention. And that's something I found that every agency has embraced, that they wanted another option. And that was the number one concern from every senior law enforcement official that we dealt with in North Carolina, was they needed another option on how to help the community that was dealing with substance misuse. And harm reduction gives us those other options and those other tools in the toolbox to help individuals.
Thank you so much for that. I'll tell you, the last question I have for you today is really, how can Fayette County benefit from a harm reduction program? Like, what are the benefits?
Well, I know that we have spoke earlier with a group about your syringe services program, which, again, in 2015 was law enforcement would not have anything to do with that in North Carolina. It was, not only was it something we hadn't heard about, it seemed like you were facilitating things. But the studies show, and we wouldn't have gone into something half-cocked or willy-nilly, as people say, if you couldn't show me the statistics and the studies that the programs like syringe exchange works. And in this case, syringe exchanges is maybe almost one of the best bangs for your buck. All right, again, law enforcement doesn't have to do anything except allow the program to exist. And what we know in syringe exchange programs are some very specific things that it does. One, it puts naloxone into the community that needs it the most. In our programs, we give naloxone out to anyone that needs it. As a matter of fact, we try to give it to them. And that reduces our overdose deaths. That's, in my world, is what's more important than saving a life. You've got to keep an individual alive long enough to find a better way. Right? If they're not alive, they can't be helped. We all know that. And they're all somebody's loved one. The syringe exchange in North Carolina had a great deal to do. We were spiking in our HIV and hepatitis C rates. And for 7 cents, we can stop that. Like with an unused syringe, or we can pass that out for 7 cents. And instead of a person dealing with HIV or Hep C for their entire life and costing the community $500,000 or more to treat them for a lifetime, for 7 cents, we stop that, right? And we also know that a person that's in a syringe exchange program that participates, for whatever reason they're participating, are 4 to 5 times more likely to seek services. And what that means in real life is this: 20 to 25% of everybody in North Carolina that goes into a syringe exchange program, which means they exchange used syringes for unused syringes, find services. What program does that? What other program can say you do that, that they go and they seek services because they're being spoke to by people that understand the life that they've lived and what they have dealt with in their life, and they're willing to help them, and they know how to get them to the services they need when they're ready for them. So the syringe exchange programs are fantastic for that. It also, in my world, in law enforcement, and that's what I deal with mostly, is we know that 1 out of 3 officers are going to get an accidental stick with a syringe in their 30-year career. These programs cut that down by 66%. So it's not just law enforcement that doesn't get stuck by a needle. It's firemen, EMS, emergency room personnel. We're saving all those people from an accidental stick, and we're also taking so many syringes off the street that may be infected with HIV and hepatitis C, because people are going to use a syringe until they get a new syringe. They're not throwing that away. They're going to use it over and over again, and they're going to share it, which causes it to have a much greater chance of being infected with something, right? By giving the unused syringes, we stop that, right? That ripple effect never goes out. That person doesn't get an infectious disease, and they don't expose another person to that infectious disease. So, and the syringe exchange program, as we talked, doesn't just give out unused syringes. It gives out the services. And it's a hub for all the services that the community we're trying to help needs. So, to me, the syringe exchange program has been the easiest thing we've done in North Carolina. It has not affected law enforcement negatively. No one gets out of jail free because of it. But we give people immunity for the syringes that they turn in, so that they feel more free to come to the services and to turn in the syringes. There aren't discarded in public areas, and our syringe service program personnel will immediately go out and clean up an area that is reported. So we have found nothing but positive results from our syringe exchange programs.
Wow. Thank you so much for sharing your expertise with us today. I think it's important for the community to hear that 1 in 4 that go and actually get help. And so thank you for encouraging us here in Fayette County. And thanks for your time
No
today.
problem. Good luck.
Thank you. Hello, my name is Holly Dunn, and I work with Communities That Care. And we've recently done an Stigma campaign. And today I have the pleasure to introduce you to Robert Childs, who comes to us with a public health background. And he's going to share with us a little bit about naloxone and kind of explain it to us today.
Absolutely. So thank you for having me here today. It's a joy to be in your county and to be with folks in your community working on reducing overdose mortality. So I'm going to talk to you about naloxone today. Sometimes people call it by its brand name Narcan, but I'm going to use naloxone for this discussion. And naloxone is just an opiate and opiate-based drug that reverses their effects of any opiate or opioid. So say, for example, I ingest too many opiates and opioids. Say, for example, I was in a period of abstinence and then I consumed some, or I got more than what I was expecting. Say, for example, I took a drug that had fentanyl in it. It may cause me then to overdose. What we want to do at that point is basically get the antidote, which is naloxone, into the person's body. Whether we inject that or use a nasal spray, it will then go into the body and neutralize the effect of the opiate or opioid. And if we do that, it brings them back to life. And opiates and opioids like sitting on the receptor sites in your brain that also tell you to breathe. And so what happens in an opiate or opioid-based drug overdose is somebody basically loses their ability to breathe. So if you inject naloxone or squirt it up somebody's nostril, what's going to happen is it will get into the body. Naloxone has a high binding affinity to the opiate and opioid receptors, kicks the opioids off, and allows you to breathe again. It's completely unharmful medication. I could drink a gallon of it, nothing would happen. But if I have an opiate or opioid in my system, all it does is bring people back to life. It's basically a Lazarus drug. All it's doing is giving somebody another chance for another day, because if they're 6 feet underground, they can't recover. So what we want to do is give people another opportunity to survive. So I wanted to show everyone how to use it today, because it's one thing to talk about it, it's another thing to actually train everybody. It's super easy to use. It's one of the most simple medications, period, to administer, and you can't mess it up. So it's a fantastic drug. I bought a kit with me from the Indiana Recovery Alliance, and it's in a UV protected baggie. And inside you have directions on how to use it. Again, it's super simple to use, so we're not going to worry too much about that. And it's very innate to use. So everybody's had an injection in their life. Whether you liked it or not, it's a whole nother story, right? Most people don't have a pleasant vaccination story. You're like, that hurts. I didn't enjoy that. But everybody knows how to use it, right? Yeah. So in your kit that you can get from the Indiana Recovery Alliance or one of the great local organizations here is you'll have a couple syringes. These are 3 cc intramuscular needles. They're about 3 fingers long. And then you're also going to have a couple vials of naloxone. Now, the great thing with the kits they give out is, say, for example, multiple people in your household took a drug. You have enough doses to reverse a couple people. So that's fantastic. The other thing is if the overdose actually requires more than 1 dose, you have a couple doses with you and you can reverse the overdose. So in order to tell if somebody's overdosed or not, there's a couple things you can do. You can yell at them really loudly. Say, hey, are you okay? If they don't respond to that,
they're not okay.
They're not okay. The other thing you can tell is basically I call it the death test, which is just a sternum rub. So a sternum rub is just basically a fist like this and then taking those knuckles and rubbing straight up and down your chest as hard as you can. If somebody doesn't yell at you at that point, it means they're going to die. So at that point, if you can, call 911. But I fully acknowledge if there's illegal drugs in the household, somebody may not call 911 because they don't have full protection in Indiana. So what you want to do at that point is we encourage everyone to call 911, but I also want to acknowledge some people won't call 911. But again, we fully encourage you to do so. At that point, you want to take your naloxone and your syringe out. You pop the orange cap off the naloxone vial, and then you stick your syringe into the vial, and you just pull it, and the liquid will come out. With naloxone, we're not worried about air bubbles because we're not shooting it in the vein. But ideally, don't get them in there. After that, you're going to take your full dose, and then you're just going to hit them in the side of the arm. You can send them in the side of the leg. You can hit them in the bum. All totally fine. As long as you're getting it in the body, fantastic. What happens after that point is you want to check for breathing. So you want to, if you notice that they're breathing, fantastic, flip them on their side. If they're not breathing, what you want to do is pinch the nose, lift the chin, 1 breath every 5 seconds. You don't need to do CPR in any way or form, but you do need to do rescue breathing. So again, opiates and opioids are going to impact your ability to breathe. And what we know is we want to encourage the restoration of breath. So naloxone is going to do that after a couple minutes of administration. But in the meantime, they need to breathe, and you may need to breathe for them. So again, lift the chin, pinch the nose, a couple breaths. If after 3 minutes breath is not restored, hit them with a second dose. Again, you can inject them with all the naloxone in the world, you can't hurt them. But what we do want to encourage is if they aren't breathing after 3 minutes, to actually give them a second dose, and that 3 minutes is going to seem like an hour. But if you have a phone, check the phone. If you have a watch, check your watch, or do the best job you can. It's a crisis situation, so do the best you can. After a couple minutes, their breathing should be restored. I've used naloxone many, many times. Every time it's worked. I know paramedics have used it many times. Every time it works, as long as they haven't, not been breathing for an extended long period of time where there is no hope at that point. But if you're by the overdose, it should work.
So the more quickly it's administered, the better.
Absolutely.
Right.
And also then we can prevent brain damage and other potential issues with when somebody hasn't breathed for a long time. So after breathing's restored, flip them on their side. And the reason we're doing that is in case they puke. What happens if they puke and if they're lying back, they can choke on the puke. We don't want that. So lift them on the side. Very small % of people actually puke. But it is a potential risk, so we want them on their side. The other thing is just to orientate them when they're coming back. They're going to be confused what just happened. And so what's important is to give them love, care, and also to connect them to care. So I know the syringe service program's opening back up soon in a few months, is connect them to that program if they plan to continue to use drugs. If they're ready for treatment, we know the best thing is to link them to methadone and buprenorphine programs. If they're ready for recovery-based support services, is to link them to recovery-based support services and care. But also know that after somebody's come out of an overdose, they may feel horrible. They're going to be in withdrawal. So imagine if I was taking opiates or opioids for pain, I'm coming back with 100% pain, and I'm going to be in withdrawal, and I'm going to be confused, and I may have flu-like symptoms.
So you're going to feel pretty awful.
You're not going to feel very happy, no. And so what's important to know is they may not be able to hear anything for a little bit, and most people are going to wake up, and I just used the clinical term, grumpy. So it's just important to know that individuals who are coming out, give them support, care, and love, and connect to care. Also know people who are overdosed are likely to potentially overdose again, and it just is something that may occur. So again, connect them with your local naloxone provider, which may be your syringe service program, or another provider who can access care. You can also contact the Indiana Recovery Alliance, and they are able to find the local spot for you, which again can connect them to care, and we want to get them into services if possible. So again, if continued drug use is an option, we want to get them in syringe service programs. If they're seeking treatment, we want to help connect them to methadone and buprenorphine programs. And if they're seeking recovery, let's get them into the recovery programs.
Great. Thank you so much for your time today.
Thank you.
I really appreciate all your effort.
Appreciate your time.
Thank you.
Thank you.